Behind every tent, every doorway, every street corner, there is a person, a story, and a system struggling to keep up. Welcome to this KOMO News Town Hall. I'm Steve Solis. As we take a close look at the homelessness crisis right here in Western Washington, you're going to hear from organizations on the front lines working to get people off the street. Seattle Downtown Business Association that deals with the fallout firsthand, and shelters fighting to turn temporary beds into permanent homes. The homeless can be seen on street corners across our region. And now the numbers are backing up what many already suspected. The population on the streets is rising. The King County Regional Homelessness Authority's point-in-time count shows the number of homeless individuals has surged by thousands in just 4 years. The 2026 point-in-time count shows King County at a record 18,365 homeless individuals. That is a 9% jump from 2024. And it comes after a staggering 26% increase from 2022 to 2024. And this is happening despite King County and Seattle pouring a combined $150 million a year into the fight, leaving many demanding answers. But before we get to where the system is failing, let's start with the root question. What's really driving this crisis? And the answer truly depends on who you ask. What is the biggest driver of homelessness in our region?
There is not enough housing that is affordable to people with extremely low incomes, combined with the different kinds of support that different subpopulations of people with extremely low incomes have.
What is the biggest driver of homelessness in our region?
Untreated mental illness, substance use disorder, and broken relationships.
You just heard from two people from two different groups that are working to battle Seattle's ongoing homelessness crisis. They've been overrun by homeless camps, cleared out, only for a new camp to return. Last year, it made headlines again, this time for becoming a dumping ground.
It looks actually like a transfer station. It looks like a dump.
City crews cleared the camp after We Heart Seattle raised the alarm, but they say the harder problem was not the trash. It was convincing people to accept help at all. Within days, new tents went up on that same ground. It is a pattern repeated across Seattle's parks, and one with seemingly no end in sight. Here's my conversation with We Heart Seattle founder and executive director, Andrea Suarez. First, if you can, for anybody who doesn't know about We Heart Seattle, tell us exactly what the group is.
We Heart Seattle is a grassroots movement that started more than 5 years ago simply by picking up trash. And that mundane act has revealed the truth beneath the trash and helped us connect to people experiencing homelessness in the woods and parks and under bridges. And in doing that, we've been able to triage people to treatment, tickets home, back to family, back to jail. Some people, many people, most people have open warrants. And so our place in this belly of the beast is really to act as a gap fill, as a private-public relationship with the government, though not formalized, but that's what we're hoping to achieve.
You mentioned that it started just by picking up trash. Was that the mission when you guys started? Then how did that evolve into what it is today?
Honestly, it really was birthed out of frustration after I had called every other governmental agency in the fall of 2020. There were needles everywhere, human suffering, parks were taken over by encampments. And after that had fell flat, I decided to go to Home Depot and buy a box of bags and start what's now more than 550 litter picks, galvanizing more than 75,000 hours of volunteer hours, and putting on display that we have a spectacular policy failure. Having picked up 2 million pounds of trash helped us connect people where they were at, but not leave them where they were at. And everyday people can really pick up the phone and learn where the resources are. And we've helped hundreds of people exit homelessness by simply picking up trash.
You've multiple times have told KOMO News that what Seattle is doing isn't working. When you say that, specifically, what do you think isn't working, and what would you do differently?
What's not working is warehousing men and women with untreated mental illness, substance abuse disorder, and putting them into what we call permanent supportive housing for life, with no requirement to enroll in treatment, mental health care, It's an option, not a requirement. And I think that's where we've gone wrong. And the data is now not lying. We now have the number one growth in the nation, 418+% in increased homelessness. We're number 4 in the country in overdose deaths. And we keep building and building and putting money in, and we're not getting the outcomes. So we must ask ourselves, do we have an inflow crisis? Do we have an affordability crisis? Do we have a mental health care crisis? All of the above. But the number one thing that we're doing wrong for the crisis population, meaning the people that we see on the ground, folding over, languishing in doorsteps, utilizing our parks for camping and drug use, they need treatment first.
You have been critical of the housing first model, but it's a very popular model in our region. If you could redesign the system, what would that ideal approach look like?
The ideal approach would be to triage people from, say, for example, they get a low-level arrest or a high-level arrest. Triage them to not just a diversion program, but to treatment for up to 6 months through a variety of programs that are available under state insurance. We do it every day at We Hurt Seattle. My biggest beef right now is that the number one program that the city is leaning into is LEAD, the Law Enforcement Assistant Diversion Program. We've been doing this for 10 years. Homelessness has skyrocketed. Why? Drugs are not free. So people are coming into Seattle, getting a jail out of free card, they're getting a get out of jail free card and going into a diversion program where they get to continue to smoke fentanyl. This is insane to me. This is the number one killer in our country for our ages 18 to 45. And our diversion program in the city of Seattle is to put them into a program where they can continue to smoke fentanyl. No wonder homelessness has skyrocketed. We're inviting people into our city and our county into a no rules playground where there's no consequences to smoke drugs and to commit crime to support your drug habit. And that's my biggest complaint.
People out in the field, what have you learned about why they may either accept or refuse help?
We have, thank you for the question. We have helped hundreds of people access medical detox and pathways to self-sufficiency and clean and sober housing. The problem is it's not mandated. So while we do find unicorns and people who are ready, we kind of call it low-hanging fruit, people who've had enough. We find them in the field and we get them triaged to Alala, Lakeside Milam, Skagit, Evergreen, Royal Valley. There are so many places for people to go get medically There are so many places for people to go get medically detoxed that people are actually calling us saying, we have open beds. So we have to ask ourselves, why are we not triaging more people to these facilities? Number one is outreach workers are actually told, do not coerce people to go. Do not assert their plan that you think they should do. And from my perspective, I say, if somebody is on methamphetamines and fentanyl, they probably can't figure out what their best life plan is. Their plan is to get drugs, to not get sick. So there is space available and there are organizations that will pay for.
How would you better allocate those resources to make sure that homelessness is addressed in the way it needs to be?
Well, it certainly seems that the more we spend, the bigger the problem gets. So we either have an inflow problem or we just have broken policy. But if I could wave my magic wand, it would start really on the ground with some just basic cultural principles, like not handing out foil and crack pipes to do drugs. King County Behavioral Health Department is handing out the very tools that are taking the lives of our loved ones. For me, that is a shift of drug friendly versus drugs not allowed. So stop handing out drug paraphernalia. Secondly, my mantra is making it hard to get high and easier to get clean. Enforcement tactics like banning camping. You can't set up a tent in a park and a sidewalk. These tents are often used to traffic women, hold stolen goods, drugs. And so those are two low-hanging fruit, but also it doesn't cost anything for the leaders in our county, city, and state to simply say, We are a recovery community, not a drug-friendly community. So I think often just with words, leadership can start to change that. We're done. No more drugs on our streets, in our parks, and our sidewalks. But one of the most low-hanging fruit things we could do to send the message, stop handing out drug paraphernalia, foil and glass pipes to do drugs. What are we doing? Secondly, ban camping. You can't put a tent wherever you want. Full stop.